Okay, this is a maxillary central incisor radiograph, and we are going to do the interpretation today. Can you all tell me which are the teeth that you can see? Assuming that this is the first quadrant.
1, 1, 1, 2.
Yeah, and which is the tooth adjacent to it?
1, 3.
1, 3. Most likely 1, 3, but somehow the
Extracted
root doesn't look very long. Yeah, so we're not very sure. Probably a canine or maybe a first premolar because we can't see the root so clearly. Anyways, can you tell me what landmarks you can see? Yes? What are the landmarks? Maxillary sinus, floor, very good. Then that is the floor, next is the floor of the nasal fossa. And what do you call the...
Inverted.
Yeah, the inverted
Inverted
Y
line.
line. Inverted Y line. Yeah, you can see it clearly here. That's the inverted Y line. Very good. Okay, so what else can we see?
Nasal septum.
Nasal
Nasal
septum.
septum. Nasal septum there, yes, that's the nasal septum.
Maxillary suture.
Intermaxillary suture, yes. Incisor foramen. No. That's not the incisor foramen. Maybe we should think again. Generally, it's between the roots of the two central incisors. So, yes, that's the incisor foramen. Very good. Any other? Have we left out anything else?
Anterior.
Nasal spine. Okay, nasal spine again. Somewhere there. Yes. More likely that it is a little lower than that. That is the nasal spine. Okay. So you should remember that it's exactly not that exactly. That's the nasal spine. Okay. Fine. Now let's move on. Which are our teeth of interest?
1, 2, and then adjacent tooth.
And then the adjacent tooth. Let's assume that it's a canine. Yes. So what are we seeing at the teeth? Yes. Can we go to the crown first, please? Yes. And the crown, what are we seeing? That there is
Secondary caries.
Setting in the
possibly secondary caries.
There's radiolucency.
Again, very good. Radiolucency involving pulp. And then in the adjacent tooth, we see that there is also looks like a fractured restoration. Yes?
Yes.
Yeah, fractured restoration involving the... Is it involving pulp? What is that radio opacity there?
Restoration.
Restoration.
Probably on the lingual side. Yeah, on a radiograph, you can't really make that out. Yeah. And then move on to the next part, the roots. Roots. How do the roots look? Oh, yeah, sorry, we
There's
missed
void.
there's a big void, yes.
Yeah.
So what is that? Radio opacity there? Yeah. So what is the material generally used?
Gutta percha.
Yeah. So what have they missed here?
Incomplete obturation.
Incomplete obturation. Very good. Can you see the? Has it reached the apical 1/3? No. Yeah. So there is incomplete obturation there. Okay. So next, let's come to the roots of the teeth. They look okay. The roots look okay. Yeah. After the root is height of alveolar bone. Looks okay. Does it look okay?
Yes.
Okay. Next, pedial space. What happened to the pedial space? Can we discuss it? Widen.
Of pedial space.
Yes. You can see somewhere up to here, and then the pedial space somehow disappears towards the end of the tooth. In these areas, you can't see the pedial space anymore. Okay. Similarly, in the next tooth, as well, you can't see the pedial space very clearly, right? So you can see that the lamina dura is intact and thickened in this area, but somehow there is loss of lamina dura and pedial space at the apex of the tooth. Okay. What about the this area? Basically, doesn't have any lamina dura or PDL. Yeah,
Radiolucency.
yeah. You can see a complete radiolucency
At the
apex
surrounding the
surrounding the apex of the tooth. So The radiolucency is in fact ill-defined, and it is moving, and I mean it is extending up to the adjacent tooth, right? So what is your diagnosis? There are 3 teeth involved here. One of them is the central incisor. Apex is also having a radiolucency which looks ill-defined or slightly well-defined, but towards the upper part of the tooth it is ill-defined towards this area. Okay, upper part of the this area looks ill-defined, right? And then next is your lateral incisor. All looks completely ill-defined, large radiolucency extending to the apex of the canine. So can we now discuss the diagnosis? Remove the magnifier. Remove magnifier. Yeah. Can we discuss the diagnosis for this radiograph? Yeah, for the central incisor. Yes, for that. And for the lateral, well-defined radiolucency. For central incisor, more likely to be a periapical. Okay, and what about the lateral incisor?
Periapical abscess.
Very good. So chronic, good.
Chronic.
Chronic periapical abscess. Now, can you give a differential diagnosis for periapical granuloma?
Periapical cyst.
Very good. Okay, and what about periapical abscess?
Periapical early stage of periapical cerebral
Osteospecial.
PCD, early stage, or any other?
verifying ostitis.
Rarefying ostitis. Very good. Right? So that is your radiographic interpretation. Thank you.